Hi, my name is Dr. Clive Gallagher. I'm a plastic and reconstructive surgeon with a special interest in gender affirmation surgery. This video is for trans feminine patients who are considering undergoing bottom surgery. And so, as we've spoken about before, when deciding which procedure is right for you, there's a menu of options. And really, you know, if anything, my patients have taught me gender affirmation is a very personal experience, and what may be affirming to one patient may not work for another. So it's certainly good to have options. And so one option about 20% of our bottom surgery patients take is to undergo what was in the past called zero depth vaginoplasty, or a zero depth procedure. Probably a better term for that would be a vulvoplasty, because of course there is no vaginoplasty. Basically what that means is we're feminizing the external genitalia, and we're doing everything pretty much except creating the vaginal canal. So oftentimes when patients ask me, you know, what are other patients' motivations to do this, it can be kind of helpful a little bit to get a sense in that, you know, what procedure is right for them. So very helpfully, Dr. Jens Burley, who's a colleague in Portland, Oregon, and his team, I believe it was Dr. Zhang was the first author in that paper, put together data answering just that question. What motivates a trans feminine patient to undergo a zero depth procedure or a vulvoplasty? So the answer is very similar to what I see in my patients. The majority of patients have simply no no sexual need for it. So they're not interested in undergoing vaginal intercourse or using it sexually. So why would they put themselves through the additional procedure and the upkeep with dilation? So that would be the most common motivation I see, and that's what they saw in 68% of their patients. Other reasons they saw in their group were health issues, and sometimes rarely we do see this in a patient, for example, that has maybe a serious heart condition and we're really trying to limit time under anesthesia, or particularly for patients who've had prostate problems before, like prostate cancer, have undergone surgery there, or have had radiation. Sometimes it can be a little bit more difficult to create the new vagina there. So for patients like that, a zero depth procedure can be safer. Other reasons patients opted for it was advanced age, and that they didn't want to dilate, and also in their study they talked about timing. So when they looked at satisfaction rates, like what I see amongst my patients, regret seems to be extremely rare after this. And in short-term follow-up, they found that satisfaction rates were very high, and 93% of patients were very satisfied with their procedure, which is what we see as well. And then the other topic that comes up sometimes is whether or not this is considered a fully feminine procedure by patients. And 82% of patients in their study do consider themselves fully feminine, or that they are trans feminine patients as opposed to maybe non-binary patients. And I would see that probably reflects as well in our patient group. So the decision as to what sort of bottom surgery is affirming for a particular individual, again, is a very personal one. By the time patients come to my office, oftentimes they know deep down what is right for them, and they may have discussed it with their therapist as well. If not, hopefully this video will help in understanding what the motivations are in opting for a zero depth procedure.